Welcome to our town hall. Thanks so much. 多謝各位參加我哋今日嘅新冠肺炎視像城市論壇。今日係我哋嘅第29集。So this is our 29th episode on COVID related topics. And today we are going to concentrate ourselves on mental health. And Dr. Descartes Li was nice enough to come up with this nice title. It says Mental Wellness in a Polarized America. And it couldn't be any more appropriate than what he came up with. And so I am Diana Lau, and I'm director of the Asian Health Institute that sponsors this type of town halls. 我咧就係劉雪艷，就係呢個加州大學舊金山分校亞裔健康研究院嘅主任。咁我哋咧已經做咗29個論壇㗎啦。咁今日咧就好高興係得到一班精英啊，心理病嘅精英嚟到同我哋講解呢個精神健康嘅心理健康。So we have 3 speakers today: Dr. Descartes Li, Dr. Tammy Duong, and Dr. Hwa Soo Hoang. And these 3 are truly experts in our Department of Psychiatry and Behavioral Sciences. They've worked in the department for quite a while now, and I'll be introducing them one by one a little later. 咁我哋今日咧就有3位教授嚟到同我哋做呢個講座嘅，就係李醫生啦、董醫生啦，同埋呢個康醫生。咁咧就李醫生咧就中國人嚟嘅，董醫生咧就係越南人嚟嘅。咁康醫生咧就係韓裔啊。咁所以咧呢位三位醫生咧都係同不同嘅背景嚟到同我哋講呢個心理健康嘅問題嘅。咁我哋陣間又會逐個介紹佢哋啦。So the agenda today is pretty simple. We have the introduction and the Q&A and the closing at the beginning and end. And then in the middle, we're talking about mental wellness across the whole lifespan. And so Dr. Li will talk about adults, and Dr. Duong is going to talk about geriatrics, and Dr. Hoang is going to talk about child and adolescents. 咁咧，我哋今日嘅議程咧就係有3部分啦，不嬲都係咁噶啦。一個咧就係簡介啦，一個咧就係個戲肉啦，然後咧跟住咧就有個問答，咁然後咧就總結嘅。咁咧咁個戲肉咧就今日咧就講心理健康咧，就講我哋嘅心理健康咧就由細個一路到老人 ，OK 至死為止嘅不同階段嘅心理健康。咁咧就由3位醫生一人講一段嘅。李醫生講成人啦，董醫生咧就講係老人啦，咁然後咧康醫生咧就係講兒童同埋青少年，所以係3個不同嘅階段，我哋都會去講述嘅。咁當然我哋呢個就係我哋嘅議題啦，就係有一個兩極化嘅美國啦。So this is the part of the title that we are living in a polarized America. Everything is like we have 2 sides to everything. And then there's something gray in the middle also. So anyhow, in every aspect, how the US-China relationship is going, the vaxxers and the anti-vaxxers, and information, disinformation, and every single one of them. And Dr. Li is going to go more into this type of issues. And so no wonder it gets us kind of confused, and sometimes they don't know what to do. I just came across this sort of data, so I just want to share that with you very briefly. But basically, it's just telling you that if we look at it globally, we say that, oh yeah, we have a lot of depression in America. When you look at it in more details, then we find out that at different stages of our life, different age ranges, the rate of depression and mental illnesses are not the same. And so this slide just kind of shows you that the red line on the top, which kind of surprised me, that has the highest rate of serious mental illness in 2020, 2 years ago at the beginning of COVID, is actually in the 18 to 25 years old. And that this slide did not increase the group that's below that, the teenagers from 12 to 17 years old. So we don't see that, but we expect that would be even higher, because you can see that, the age as people get older, seems like the mental illnesses kind of decrease in frequency on the slide anyways. And these are data from some surveys that's done by the SAMHSA which is the Substance Abuse and Mental Health Association. So 嗰個係由一個去查吸毒嗰啲情況同埋嗰個心理健康嘅情況嘅一個研究嚟到發現到呢啲咁嘅數據嘅。咁咧呢個咧就係由2017年到2020年啦，就12歲以上嘅亞裔，呢個係亞裔嗰啲指數嚟嘅。佢嘅主要嘅憂鬱發作嘅次數，即係佢憂鬱發作幾多次咧咁咧又係睇到啦。你見到咧呢個咧就係個年齡啊，12至17歲、18至25歲，跟住呢啲係大啲啦。咁咧發病率高啊多嘅年齡咧，原來咧又係細嗰啲多嘅，即係青少年咧係多發病係有呢個憂鬱症嘅。So this is another set of data from SAMHSA that again it shows that people who are of the lesser age group, the teenagers and the young adults, they have a lot more times of having episodes of major depression than the older group. So that's a kind of unexpected again. And then this one is talking about suicidal tendencies and planning and actually attempting it. So this set is serious thoughts about suicide. This is making a plan for it. And then this is actually trying it. And so you can see that again, this graph is for young adults 18 to 25, and this graph is for the older adults 26 to 49. And you can also see that the rate of that is again higher in the younger age group, the people who have suicidal tendencies. And then this is almost like 10% of young adults 18 to 25 years old have thought about attempting suicide. And then about 1/5 of that, 20%, is about 1 in 5 of those people would make a plan for it. And then about half of those who made a plan actually try it out. And so the rates are high. Compared to the older group, you can see that it's only 2.5% as versus 10%. So the rates are a lot lower as we mature into adulthood. That's my little introduction, just to kind of show you how serious the mental health situation is. 咁咧就係即係我哋見到咧係青少年咧係好有問題嘅，佢哋自殺嘅念頭有多啲人啦，有成1成嘅人嘅青少年咧係曾經有過自殺嘅念頭嘅。咁然後咧佢哋咧即係嗰個有呢個憂鬱症咧，又係多咗，有成10個人之中有1個咧嘅青少年咧係曾經有過憂鬱症嘅。咁我哋睇到咧就係好奇怪，喺呢個2020年咧，即係啱呢個 COVID 開始嗰一年咧，就係嗰啲數據咧就係咁樣出現嘅。我哋以為係大人會多啲憂鬱症啦，但係其實原來係青少年仲最多嘅。呢個咧就係而家繼續咧就交俾李醫生啦。So let's introduce Dr. Descartes Li, and he's Vice Chair for Education in the Department of Psychiatry and Behavioral Sciences at UCSF. 咁佢咧就係我哋舊金山大學嘅精神病學同埋行為學系嘅教育副主任嚟嘅，所以佢哋教育咧係有非常之好多經驗。咁佢咧就冇 no disclosures and 即係冇咩特別嘅利害關係啦。咁然後咧，李醫生就係中國人嚟 and Dr. Li is Chinese.
Thank you for organizing this. So I'm going to just say a few words, hopefully about, I'll spend, we'll spend 10 or 15 minutes talking about just some of the big picture items. And this is the outline, and we're going to talk about the background. I'll talk a little bit about contemporary Asian American issues, and I'll talk about the impact of COVID pandemic on Asian American mental health, and finally what you can do in resources.
咁呢個咧就係李醫生今日會講嘅大綱啦。咁咧就係佢咧就會講首先就係介紹下背景啦，咁然後咧就係講下而家美國嘅亞裔嘅問題啦。咁就講跟住係大陸即係呢個新冠肺炎對我哋亞裔嘅心理健康所產生嘅影響啦，同埋我哋可以做咩咧？咁其實最後邊嗰個咧就係非常之重要嘅，有咩資源咧咁。
So first I'll start with just a little bit of background, and I'm sure people are kind of aware of this already, but more recently China is being viewed as a kind of a long-term strategic adversary to the US.
咁我哋不嬲都知道中國而家係成日俾美國打住㗎啦嚇。
And this is just a quick Google search that I did a few months ago, just showing all the different kinds of articles that are online.
咁呢啲咧就係佢大概1個月前度咧上去 Google 嗰度搜索咧就發現咗呢啲咁嘅即係好負面嘅資料咯，即係美國人對中國嘅負面資料。
Just the other day, it was President Biden was issuing new orders, and people were concerned about China running spy operations.
咁咧就前嗰幾日就咁咧，拜登總統咧就係發布命令咧，就係唔准美國嘅公司喺中國嗰度投資嗰啲科技嗰啲嘢嘅。
Let's talk a little bit more about Asian American issues. Here in the United States, things that have happened. I'm pretty sure everyone in the audience is familiar with the Atlanta shooting.
咁我哋睇到咧，就係喺美國咧，啲美國人咧係而家係相當仇視亞裔咯。總之佢都唔理你係中國人，因為咩人啊？總之你係佢覺得好似係中國人咁嘅樣咧，又對所有嘅亞裔咧，佢都係有攻擊性嘅心理啊，好多。
Oh, this is just an article from the New Yorker. If anyone has a chance to read it, I thought it was pretty good. Kind of very brief commentary on the tragedy. 係啦，呢個就係舊年咧，就喺亞特蘭大嗰度嗰個槍擊案嗰度咧，我哋都曾經有提過噶啦，就係有個男仔咧，白人男仔嚟嘅，走去亞特蘭大嗰度就嗰啲SPA 就開槍射死咗6個亞裔嘅女性嘅。 With the AAPI hate website and the stop and then the mental health report that went along with it.
咁大概好多在座好多位咧都曾經知道聽講過呢個Stop AAPI Hate 呢個 website 噶啦。咁咧呢個 website 咧就係喺我哋三藩市州立大學嗰度一個教授同埋另外一啲組咧就係設計出嚟嘅，就係俾我哋去填上去。如果我哋俾人仇視啊、打啊、攻擊啊，咁係俾我哋上去填嗰啲咁嘅報告嘅。
This is something that's been a very local news that's been really a big deal for the Asian community in Oakland. My mom lives in Oakland, so she knew exactly where this person had been shot and killed.
阿李醫生嘅媽咪原來住喺屋崙嗰邊嘅，咁佢咧呢個就係我哋大家都知道啦，呢件係即係非常之凄慘嘅事嚟嘅，因為係呢位女牙醫咧係相當得屋崙嘅居民愛戴嘅咯，佢做咗好多年㗎啦嗰度，佢就係上1-2個禮拜就喺街上邊俾一個人槍殺咗，係搶佢嘢咁然槍殺佢嘅，咁成個社區都好震驚啦。
And I just put this slide up with a lot of different kinds of references or books that people could look at regarding Asian Americans. We're a very diverse group of people. Maybe I'll stop there and say more. I'll let you translate, Diana.
咁咧，李醫生話咧就係佢擺呢張幻燈片上嚟咧，就係想大家睇下，就係主要講下就係亞裔，即係其實係非常之多元化咯。就算係亞裔都唔係話一種人啦嚇。
And as a group, Asians have the greatest disparities in terms of socioeconomic status and wealth. I was interested to learn that, the generation of Asian Americans called the children of Hart-Celler is more kind of can be defined more through this model minority description, but it's a very specific subgroup within the Asian American population.
Is that mentioned here in the text?
Yeah, if you can see right in the middle there, the third paragraph there, this generation of immigrants, whoops.
Oh, children of Hart-Celler.
Yeah.
It's the first time I hear about it. Interesting.
Yeah,
okay.
So that's a special group in the sense of Hart-Celler is a US law that came into being, or an act of Congress in 1965, and that permitted the immigration of people not based on prior they had a quota from each country. And so after that, you have a big influx of highly educated Asians, which tends to be the more model minority population in the Asian American subgroup, but they only represent a subgroup of the whole Asian American experience. And I think it's very important to keep that in mind, because the media and culture at large in America often tries to define Asian Americans as this one kind of simple group when it's really not. And so there's some really good books out there. The Loneliest Americans by Jay Caspian Kang, a Korean American. It's a little bit painful to read, I think, or embarrassing as an Asian American to read, but it's good reading. It's, I think, important reading. Similarly, Minor Feelings by Kathy Park Hong, also Korean American, as a series of essays, which are really excellent. And then finally, I had the good fortune of seeing a couple of these plays about Vietnamese immigration. They're actually musicals with rap music. So if you enjoy that, Viet Gone and Poor Yellow Rednecks is actually going to be playing in May, in the spring of next year at the Strand Theater. So if anyone gets a chance to check that out, highly recommend it.
咁咧，佢咧就李醫生咧就講咗，即係喺1965年嗰度咧，就曾經有一條法例嘅，叫做呢個 Hart-Celler 嘅移民法例。咁咧就係即係呢條法例咧就係大開中門，即係俾嗰啲係有經驗啊，有學歷嘅啲亞洲人咧就可以移民過嚟美國嘅，係冇限制咁樣移民嘅。咁所以咧當時咧就好多人移民咗喺美國咧，嗰啲人咧亦都係即係相當穩定啦，學歷又幾高下啦。咁咧佢哋咧就未必係受到歧視啊，即係或者唔覺得自己有歧視啦。咁咧就係呢班人咧，亦都係我哋所謂嘅model minority 呢個模範嘅少數族裔啦，就製造咗呢堆咁嘅人。咁咧咁就其實咧就有好多書咧都有描寫呢啲人嘅不同嘅經歷啦。咁咧就呢啲咧就係書名嚟嘅。呢個咧就係 Ken 呢個人咧就係韓裔嚟嘅，咁啊康呢個都係韓裔嚟嘅。咁佢哋寫咗呢啲書咧，咁李醫生咧就話你哋得閒咧可以去上網去查一查呢啲書。咁咧就亦都有啲戲啊舞台劇咧係出現嘅。咁咧譬如呢個Poor Yellow Rednecks 呢個咧就會係出年咧就會上映。咁你哋如果有興趣咧可以睇下。呢啲咧就係講我哋亞裔嘅經驗啊，喺美國嗰度嘅想法啦，咁樣樣嘅。
So this is just another slide about in reference to the more subtle forms of Asian hate and the how misogyny can be expressed as loving or preferring Asian women. But sometimes that means if we want to really respect Asian women, we might need to let go of the model minority myth.
咁即係亦都係我哋亞裔咧喺美國咧，除咗種族仇恨之外咧，有啲嘢咧就係冇咁明顯嘅，係即係喺好即係人同人交際之中咧係好微妙咁樣，你覺得佢係歧視你，但係佢唔係話唔係話講出嚟咁，即係話我唔中意你啊，你返中國，佢唔係咁講嘅，但係佢言語之間咧，你覺得佢係歧視你咯。咁咧呢啲咧就可能係我哋自己要即係擺開呢個model minority myth， 就即係唔好覺得自己真係一個模範嘅少數族裔係百毒不侵咁樣樣，其實唔係嘅。佢哋嗰啲人係其實有時係想排斥我哋，但係係一種用一啲好微妙嘅方法嚟到表達嘅。
And then another aspect during the COVID pandemic, in addition to increased anti-Asian sentiment, has been an increase of intimate partner violence, formerly known as domestic violence. And this is a page with a bunch of references or links to resources. I'll say I have another slide later too.
咁咧喺呢個大流行嘅呢個新冠肺炎大流行之中咧，除咗係種族歧視之外咧，家庭嗰度咧，家庭暴力咧都係發生咗好多嘅。
Okay, let me move on and talk a little bit about the impact of COVID pandemic on Asian American mental health.
咁佢繼續咧就會講呢個新冠肺炎大流行對我哋亞裔心理健康嘅影響啦。
So just the answer is yes. I don't know if I need to go through in detail all these references, but yes, the COVID pandemic has affected mental health. And these are just some references just to support that.
咁咧，李醫生話咧，真係有影響我哋嘅心理健康嘅。雖然我哋或者有人留意到，有人冇留意到啦。總之咧，就係除咗係影響我哋嘅荷包之外，呢個新冠肺炎嘅大流行咧係 對個心理造成好多陰影嘅，好多人都。
Here's another one that just showed right after the pandemic in April 2020. There was a big increase overall in mental health issues, or clinically, I guess in this study was clinically significant level of mental distress. You see it went up to 27% in April of 2020, compared with less than 20% as a baseline.
咁你睇到咧，呢啲就係不同嘅年份啦嚇，2014年、15年、16、17、18咁樣樣啦。咁呢個20年4月咧就係我哋美國嘅大流行咧，係呢個新冠流行咧就係喺美國3月頭開始嘅。咁呢個大概係1個月個零月咁上下啦，就發覺咧嗰啲有心理健康嘅問題咧，就係多咗一路由10幾個%升到去27.3%嘅，呢個叫做大躍跳咁樣樣嘅，由19個%升到27個%，升咗8個%。
All right, and so this is another study looking at just U.S. Population as a whole before and after or during the pandemic, I guess we should say. So you can see just the gray bars are higher than the blue bars in terms of mild, moderate, or severe symptoms.
咁呢個又係睇嗰個精神有憂鬱症狀嘅成年人嘅，呢個係成年人嘅比例啦。咁你就睇到咧就係黑色嗰個深藍色嗰個咧就係新冠肺炎之前嘅精神病啦，淺灰色或者淺藍色嗰個咧就係喺個新冠肺炎期間嘅精神憂鬱症嘅問題啦。咁你見到咧，除咗係冇嘢嗰啲人之外咧，一路咧佢咧就係你見到佢呢個輕度啊、中度啊、深度啊嗰啲咁嘅憂鬱症狀咧，佢係喺新冠肺炎嘅期間咧嘅人咧係多咗出嚟，即係多過係冇之前嘅。
So this is another study looking at individuals who had discrimination and finding that that it was associated with poorer mental health.
咁如果喺呢個新冠肺炎嘅病毒相關嘅歧視咧，係亦都會帶出一啲比較差嘅心理健康咯。即係俾人受歧視，梗係個心唔係咁開心啦，係咪？
And how might the pandemic affect mental health? One is there's just overall levels of stress, which is sometimes a vague concept. Social isolation certainly increases the risk of intimate partner violence. During the COVID pandemic, we know there was increased substance usage pretty significantly. There's also what's called long COVID now, or direct neurological effects of SARS-CoV coronavirus on the central nervous system. During the lockdown, of course, there was impaired access to healthcare. Social isolation leads to lack of exercise, and lack of access to healthcare also leads to exacerbation or worsening of pre-existing general medical conditions and increased stigmatization of the people who have mental illnesses.
咁當然有人話，咁點解呢個新冠肺炎會影響我哋嘅心理健康咧？咁其實咧大家都應該係心裏邊有個底嘅，係知道係咩事噶啦。一來就壓力多咗啦，二來咧咁你如果唔出街啊，即係驚出街啊，咁個人會覺得孤獨啲咯。咁喺期間咧吸毒嘅人咧就吸多咗咯喎。咁佢因為可能覺得唔係幾開心，佢吸到啲毒或者覺得舒服啲啦，係咪？咁咧就我哋都知道咧，呢個長新冠咧係會影響我哋嘅腦神經嘅中樞系統嘅。咁咧就唔出街又冇少咗運動啦，咁身體裏邊嘅荷爾蒙啊嘅分配又唔同咗啦。咁然後咧就以前都可能有病啊嘛。咁但係以前嗰啲病咁你又唔出得去睇醫生咯，咁嗰啲病又可能又加重咗啦，咁又覺得俾人歧視啦，我哋亞裔係咪？因為嗰啲人話我哋帶啲病菌過嚟嘅，咁所以係好多原因影響我哋心理健康嘅。
All right, well, this is a complicated slide that is meant to be a picture of potential barriers to mental health treatment in Asian populations due to COVID-19. I'm not going to go through everyone, and Diana's did a wonderful job of putting in the Chinese translation as well. So, but people can just look at it, I think, for now.
咁呢個咧就係嗰個，即係我哋通常有病就去睇醫生或者去揾人治療噶嘛。但係我哋有心理病嘅時候咧，個心理健康有問題嘅時候咧，好多時咧都係有障礙嘅，係唔去揾人治療嘅。呢個係一個好大嘅問題咯。咁啊，點解唔去揾咧？咁啊，大家心裏邊都知道啦，因為有驚住唔好意思去俾人知道自己係有心理病啊，跟住人哋睇低你啊，好多偏見啊，咁即係好多原因嘅，係嘛？咁呢張圖咧就係講有咩原因影響你唔去去接受醫療咧咁。
Okay, just more references. I think we just keep.
咁呢個咧就係我哋遲啲咧係會So we're going to send it out in the handout.
Yeah, or people want a link. Yeah.
Yeah. 咁我哋呢啲遲啲會寄俾你噶啦。所以你哋如果係冇係用電話嚟到聽嘅咧，唔該你將你嘅 email、你嘅電郵加入去我哋嘅群組嗰度。如果唔係咧，我就寄唔到俾你。OK， 我只要有你嘅 email 個電郵，我就會寄俾你。
This is an interesting article about the relationship between stress and suicide. Diana has shown a couple of slides about the prevalence of suicidal ideation and suicide attempts, which I wasn't that surprised with. That is pretty much in the realm of the general population. It's much higher than you would think.
咁呢個係講呢個壓力同埋自殺嘅關係。咁咧就有不同嘅聯繫嘅方法咯。咁正話嗰張圖片咧，亦都係有講到係不同嘅人咧，佢會有啲人咧就係淨係諗啫，咩都冇做到；有啲人咧就設計埋點樣去自殺，有啲人咧就真係去自殺嘅。咁即係呢啲係不同嘅影響，不同嘅人有不同嘅做法啦。
So let me describe the two different models of stress and suicide. Model A is where people think of stress or psychosocial factors as causing suicide or causing depression, schizophrenia, addiction, and other mental disorders. And you can see that by the heavier arrows. And that's kind of the lay understanding. But another understanding is Model B, where you have a population of people with depression, schizophrenia, addiction, and other mental disorders as the primary, I would call, vulnerable population. And that stress is not the cause, but more just a mediating factor. And that the people who have the most stress are the people who originally have significant psychiatric disorders. And the major risk factor for suicide is really the presence of psychiatric disorders.
咁咧，而家係有兩個諗法嘅。咁我哋呢兩個諗法叫佢做模型 A 同埋模型 B 啦。一個嘅諗法咧就係話，有壓力啊，所以咧就會整到人咧就會頹喪，同埋整到人咧就會有自殺嘅念頭。呢個咧就由壓力嗰個觀點去出發嘅。第二個模型咧嘅諗法咧就係話，係壓力係會影響，但係影響嘅啫。但係最主要歸根到底咧，就係嗰堆人有一堆人係已經係有呢個憂鬱症噶啦。咁因為佢受咗壓力咧，所以咧佢就會有自殺嘅傾向。但係佢自己係要有咗憂鬱症先，咁然後呢個有壓力嗰度只係幫兇嚟嘅啫咁。咁呢個就另外一個諗法嚟嘅。
And so I think the implication of this is that really the population that we need to screen are people who have psychiatric disorders and monitor those individuals with previously diagnosed mental conditions. The other thing to realize also that if you decrease stress, the impact on suicide actually is relatively modest. If you kind of if you think of like overall stress, you just try to decrease overall stress. If you're really thinking about suicide prevention, it's really targeting this already vulnerable patient subpopulation of people.
即係呢個其實就即係都幾重要嘅。即係你如果係諗邊樣嘢係令到人自殺咧，如果你第一個模型你話係因為係個社會壓力太大啦咁你咪話如果個社會嘅壓力冇咗啦，咁咪冇人自殺咯，即係你咁諗啦，係嘛？咁但係如果下邊嗰度咧就話唔係喎，有憂鬱症嗰啲人咧，佢係會自殺嘅喎。如果係個社會多啲壓力咧，佢就 更加自殺多啲，但係冇壓力咧，佢都會自殺嘅喎。咁你變咗咧，治療嗰方面咧，就變咗係用兩個做法啦。一個做法你譬如 A 型嗰度咧，你就話咁我哋將啲壓力攞走啦。如果係可以攞走嘅，我哋盡量攞走啦咁。但係嗰個其實如果用 B 模型去諗咧，就係可以幫到啲，但係唔係全部幫得到晒啊嘛。B 模型咧就係話你真係要揾到嗰啲已經係有呢個憂鬱症嘅嗰啲人士出嚟咯。咁你揾到佢哋出嚟先可以幫到佢哋嘅憂鬱症，咁先幫到佢哋唔會以後自殺咯。咁所以呢個係一個即係非常之重要嘅環節嚟啦。所以第一個咧就第一個嘅模型啊，就多數咧係普通人咧就咁諗啲壓力整到佢咁嘅啫咁。第二個咧就係嗰啲醫生咧，嗰啲心理醫生咧就知道咧就係話唔係㗎，係佢本身已經有咗憂鬱症啊，所以我哋要揾呢啲人出嚟，要早啲幫佢哋啊。
All right, and you may be aware that the CDC did add mood disorders to the list of conditions that make people more likely to have an elevated risk of severe COVID-19. So, for example, if you have diabetes or obesity, those are risk factors for more severe COVID-19. It turns out people with mood disorders also are at higher risk for having severe COVID-19.
咁大家都聽到過，知道係有邊啲人係比較係有高風險染到呢個新冠肺炎㗎啦，就係血壓高啊、糖尿病啊嗰啲人啦，係嘛？咁但係咧，又有幾多人知道原來情緒病啊、個心理健康都會影響呢個得到新冠肺炎嘅機率咧？咁我相信大家都可能冇咁時刻聽到呢啲咁嘅病咯，所以。我哋而家就帶俾你知，等你知道咧，原來個情緒嘅問題啊，都會影響你得到新冠肺炎嘅機率嘅。
I really enjoyed this commentary by this guy named Dr. Eric Tang, who he's at the University of Texas, and he just noted that we have this kind of xenophobic political climate. Asian Americans are being stigmatized. For Asians, mental health issues are not always separated from the mundane. Like life is kind of considered to be suffering, and life and anxiety and stress and anxiety are to be expected. And therefore, maybe negative incidents are underreported. He was wondering, and I don't know if it's turned out well, whether COVID will turn out to be a turning point. Like the pandemic has brought out a lot of historical racism, but it turns out many healthcare workers are Asian. So in a sense, Asian Americans are both heroes and scapegoats. And how will Asians respond to this racism? And is this an opportunity for the Asian American group to come together?
咁呢個係李醫生咧就訪問咗呢個鄧醫生，即係同佢傾過偈啦。咁呢個鄧醫生咧就講咗好多嘢咧，都令李醫生咧都好佩服佢咯。咁咧就呢個鄧醫生咧主要嚟講就係話，即係美國咧就係好多受愛嘅政治氣氛啦，對亞裔嘅人咧就污名化，叫我哋即係因為佢覺得係武漢嗰啲病毒傳過嚟啊嘛，咁對中國人有仇視嘅。咁咧，咁呢個我哋自己嘅亞裔咧個心理健康問題咧，同平時嘅生活就息息相關。咁咧就覺得我哋嗰個生活係非常之痛苦嘅，因為有咁多嘅事發生啊。咁咧壓力同埋焦慮咧都係意料中事啦，但係因為意料中事咧，咁我哋成日咧都即係盡量係冇諗佢，就將呢啲負面嘅嘢咧就低估咗佢嘅嚴重性嘅。咁咧就咁我哋叫做模範嘅少數群族啦，係嘛？咁咧就所以咧我哋係唔應該有壓力，同埋唔應該覺得羞恥嘅，係嘛？所以咧我哋係知道人哋咁樣諗我哋亦都想希望做到咁嘅方法。咁咧，但係其實我哋係咪真係少數群族咧？同埋係咪真係永遠都唔做到白人咧？即係我哋有啲亞裔咧，以為自己係好似有白人嘅文化嘅，但係白人係永遠都唔會接受佢哋，即係唔會覺得我哋自己係白人㗎咯，係咪啊？咁咧，所以咧有啲佢咧就話佢咧就話呢個新冠肺炎到底會唔會做咗一個轉捩點，就係帶嚟咗呢個大家都即係將啲醜惡嘅嘢咧，大家擺出嚟，大家講啦，係咪啊？咁咧，但係其實我哋咧就因為好多亞裔都係做醫護人員噶嘛，咁我哋一方面咧 就俾佢哋嚟到踩到啊 ，OK 話我哋係亞裔帶啲病毒過嚟，一方面咧我哋亦都救佢哋嘅，咁其實都係非常之矛盾啦，好多嘢都，咁咧所以我哋又係英雄又係罪人喺美國人心目中嚇。
Okay, let's get into what actually you can do and some resources.
咁你可以做咩咧
All right, so general coping is always encouraged. Encourage individuals of Asian descent to reach out to each other. Mindfulness, everyone likes mindfulness these days. There are a lot of good books. I mentioned some before. Here's some more authors. And then making sure, some people are caring for people with dementia or severe depression. Make sure we care for the caregiver. As I mentioned before, we want to screen for psychiatric disorder and think about suicide prevention. Disseminate these kinds of resources. Report incidents to the Stop AAPI Hate website and intimate partner violence interventions.
咁呢個我哋點樣應付呢個咁嘅健康危機咧？心理健康危機咧？咁當然我哋第一咧就係要自己識去即係應對嗰個情況啦。就大家鼓勵大家亞裔嘅人士互相接觸啦，用呢個正念嘅治療啦，睇多啲書學多啲嘢，睇下人哋點樣講啦，係咪？正話好似正話嗰啲書咁咧，俾你睇過。咁咧就係亦都係要我哋要留意下嗰啲照顧者嘅，即係唔係淨係留意嗰啲病人啊，就照顧病人嗰啲人咧，都係非常之重要嘅。咁喺醫療方面咧，我哋亦都係要去篩查呢個精神有冇個病人有冇精神病啊，同埋有冇自殺嘅傾向啊咁樣嘅。咁咧就盡量將嗰啲我哋得到嘅資源咧，就大家分享啦，同埋咧將呢啲對我哋有仇視有攻擊嘅事咧，就要上嗰個 AAPI Stop AAPI Hate 嗰個網站嗰度咧，就報告，等我哋有個數據睇下呢啲事有即係發生得幾多咁樣嚇。咁當然亦都有個我哋都要留意家暴啦，就要干預呢啲家暴嘅情況啦。
These are some basic questions to screen for mental health concerns. Are you bothered by feeling hopeless or depressed? Or depressed or hopeless? Do you have a little pleasure or interest in or pleasure in doing things, or do you feel anxious? And if these have been occurring over the past 2 weeks more often than not, it's important to then seek consultation or get some help. So these are kind of general screening questions that you can ask yourself or your family members.
嗱，呢樣嘢咧就其實非常之重要嘅，因為我哋一日過一日咁樣咧生活咧。我哋好少話停低嚟到問自己個問題啊，到底我今日點啊？或者睇下隔離嗰個啊，到底呢個即係丈夫又好，仔女又好啦，到底佢哋點啊？問啲咩問題咧？如果你自己識問下問題咧，你知道首先咧你要知道有冇問題先 ，OK？ 咁你要問自己問題，問咩問題咧？就係你呢兩個禮拜係咪好多時都感到係好頹喪同埋好絕望，同埋覺得好煩咧？咩都唔想做咧，食嘢又冇興趣咧，覺又瞓唔到啦。你係咪覺得好焦慮？樣嘢都好緊張啊，個人好多嘢擔心啊。咁你如果係發覺咧，你嘅答案咧就係呢兩個禮拜，哇！我好多時間都係咁嘅。咁你咧就會要有個醒覺，你可能有問題喎個精神。咁你就要去睇醫生，同個醫生講。即係通常咧。我哋係唔會做呢啲事嘅，但係今日你醫生咧就帶咗呢幾個問題出嚟咧，要你自己去不時咁樣去問下自己，尤其是你覺得即係個精神狀況唔係幾好嘅時候啊，咁你就要問下自己，如果你覺得係好多時都有咁嘅情形咧，你就真係要提出嚟話俾個醫生聽咯，唔好怕俾人，即係唔好話怕醜，唔敢講咯。咁呢啲問題咧，我哋係會完咗之後咧 ，again these 3 questions will email that to you。So that you have that on hand. So every time when you don't feel good, you can take that out and ask yourself the question. And you have that at your fingertip. Okay? So 呢個我哋係會用電郵寄俾你嘅，因為呢3條問題係非常非常之重要嘅，就知道你嘅心理健康有冇問題。
Really interesting, very exciting, 988 Suicide and Crisis Lifeline that was enacted by Congress. So it's like a parallel to 911. We now have 988. Unfortunately, it's only in English and Spanish. I did try to call it the other day, and they link you up to resources in your local area. So it is online. It is working right now.
咁呢個咧就係新出嘅 即係我哋有緊急事故就打911咁啊。咁而家呢個988咧就係有緊急嘅心理健康事故咧就打呢個988，即係譬如你知道有人想自殺啦咁樣，你就打呢個988。咁但係可惜咧，而家暫時嚟講咧，呢個988就淨係得英文同埋西班牙文嘅。但係啊，李醫生咧打過呢個電話，其實佢係會將你轉介到你住嘅城市裏邊嘅一啲心理健康治療嘅人幫你嘅。
It's very exciting because the law also provides for some resources to build out these crisis interventions and stuff like that too. And just as you can see, there's a QR code as well.
Yeah. 咁你如果係將呢個 QR code 呢度啦，將呢個 QR code 呢度你 scan 咗佢啦，咁你亦都可以用佢嚟到聯繫呢啲人。咁啊，李醫生咧就好高興有呢個咁嘅988呢個服務嘅，因為佢唔止係俾你可以打電話去揾人啊，但係佢亦都會有一啲資源去幫助你嘅。咁呢個係一個開始啦，可以叫做。
This is our departmental list of resources. There's a link right at the bottom. We have tons of resources for people, as you can see.
呢個咧就係我哋嗰個心理呢個精神健康部門嘅網站啊 ，UCSF 嘅嚇。咁然後咧佢裏邊咧係有好多嘅資料嘅，咁你可以上去呢度睇下啦。你可以而家影一整張相佢，咁上去咁就慢慢上去睇下。暫時咧就係英文啦，咁我哋希望第日有資源咧可以將佢譯做其他嘅亞洲語言嘅。
Okay, this is the AAP Hate Stop AAP I Hate website.
咁呢個咧就係喺下邊呢度咧就係叫做 stopaapi.org， 就係呢個 website， 你就上去可以將你嘅發生嘅事故將佢寫低做個報告。
And then for the providers, and this is more a slide for providers in the audience, if appropriate, you can ask any of the following acts of discrimination.
咁你如果係返工嗰度咧，你就可以問人咯，你有冇曾經遇到任何嘅歧視嘅行為啊咁。
Intimate partner violence resources listed here.
咁呢個咧就係嗰個家暴嗰啲資源啦。咁你又係將佢影張相啦，影咗張相咧，咁你就可以知道嗰啲電話噶啦。咁如果有咩家暴嘅情形，你可以打啲電話去求助。
And for those who want to get involved and participate in work, this is another good organization.
咁如果你哋想參加呢啲幫人嘅項目咧，咁你係可以又係可以影張相，然後揾佢哋話俾佢聽你有興趣參加。
Okay, that's it. We went over like the background between China and US, the conflict that's going on as the big international issues, our contemporary Asian American immigration and our identity issues. Then we talked about the impact of the pandemic on Asian American mental health specifically. And then finally, we wrapped up with what you can do and some resources at the end there. Thank you so much.
咁呢個就係李醫生嘅總結啦。佢今日講嗰4樣嘢，多謝。Thank you so much, Dr. Li. So we'll move on and introduce Dr. Tammy Duong. Dr. Tammy Duong is an associate clinical professor and the director of the Geriatric Psychiatric Fellowship at the UCSF Department of Psychiatry and Behavioral Sciences. 鄧醫生咧就係我哋嘅一位醫生咧，就係呢個長者精神病學研究基金嘅主任，同埋咧係呢個加州大學舊金山分校嘅精神病學同埋行為科學系嘅一個副教授嚟嘅。
Okay, perfect. Thank you so much, Diana, for having me back, and thank you so much for all the hard work that you do. So for this very brief talk, what I really hope for us to get out of it is to recognize a little bit of the importance of mental health in Asian Americans, although Dr. Li was already outlined kind of those great points. Talk about the risk factors for depression for older adults, and then take away some really practical tips for treatment of older adults with depression.
咁咧，鄧醫生咧就會同我哋講呢3樣嘢嘅，就係主要咧就係 講一啲係長者嘅心理健康問題。
So geriatric depression is this broad term that we use to really capture all of older adults with depression. And if you break it down even further, you can break it down into two big categories, late life depression and early onset depression. And late life depression is depression for folks who their symptoms start after the age of 60. It usually happens with some kind of stressors, or maybe they have a lot of other medical conditions happening at the same time. This accounts for about, somewhere between 40% to half of the cases of depression in older adults. And then you have early onset depression. So this is for patients who have depression before the age of 60, and then maybe they're getting older and they carry it with them into later life. And this accounts maybe somewhere around 2/3 of cases.
咁咧，呢個長者憂鬱症咧就係即係年紀大啲嘅人啦。咁咧就係包含咧所有憂鬱症嘅症狀嘅。咁咧就分開兩種咧，一個咧就係早期，一個咧就係晚年嘅。咁晚年嗰啲咧就係60歲之後發病嗰啲叫晚年。咁咧通常咧就因為生活壓力啊，或者身體好多病痛啊，咁咧就整到個人憂鬱嘅，就大概係40%度啦。咁然後咧就呢個早期嘅憂鬱症咧，就係60歲之前有病嘅。就可能呢啲人咧，亦都有機會係有家族歷史啦，同埋係一啲慢性病。咁咧，呢啲早期性嘅憂鬱症咧，就大概係60%度。
Okay. And a brief word on mental health and mental utilization for Asian Americans and Pacific Islanders. If you think about us broadly as a minority group, we're the least likely to use mental health services compared to all the other minority groups across America. So we're 2 to 5 times less likely than other groups. And this is even if you take in account of, location, age, gender, education, or any kind of Asian subgroup. If you, as a whole total, we're not using mental health services.
呢個就係我哋亞裔同埋呢個太平洋島民嘅一個大問題啦。就係我哋有心理病嘅時候咧，我哋好少去睇醫生去用即係揾人幫我哋嘅。咁咧喺一個可能控制嘅情形之下咧，我哋就比其他嘅少數族裔嘅用醫療嘅人咧係少2至5倍嘅，即係非常之少啦。咁咧就無論係你點樣睇咧，就話喺邊度住啊，咩年齡啊，咩性別啊，咩教育程度啊，任何嘅亞裔群體，我唔理你係中國人、西班牙人、日本人、美國人咁樣，咁咧就我哋咧嘅亞裔嘅用嗰個醫療嘅方法咧，做心理健康嘅醫療咧係少好多咯，即係有病唔醫病嗰類。
And I wanted to say a brief word about Vietnamese Americans, because I'm Vietnamese American. And what do we do when we try to seek help for depression? There's a lot of content on the slide, but I'll just quickly summarize that if you look at it, the majority of the time, Vietnamese Americans really would rather seek help from friends or family members. So one of the great things you can do is really be informed on this topic. So when they come to you, you've got some great advice to give them. The good news is that a good chunk of Vietnamese Americans actually would seek some mental health care, either from their family practice physician or a mental health professional. And the drivers to make them more likely to actually seek help from a professional is if they have more medical comorbidities, or if they actually have access to healthcare. But then there's another big part of the population of Vietnamese Americans who would just say, hey, I'd rather just look up things myself, not seek help at all. And then there's another sliver of the population that would say, like, I'm willing to see my family practice physician, but I don't want to see a mental health provider at all.
I think that what happens to Vietnamese Americans also happened to other Asian Americans. It's probably very similar. So 咁董醫生咧就講，佢話佢自己係越南人啦，咁所以咧佢咧就話以越南裔嘅美國人咧嚟做一個比喻嘅。佢話越南人咧，佢話好多人咧就係多數咧就 唔去睇醫生啦，就去問家人啊或者朋友啊，我而家佢咁嘅情形啊，點樣做啊咁，或者咧佢哋咧亦都會去揾呢個家庭醫生或者心理嘅專家嚟到幫嘅，但係佢即係嗰啲人咧就多數係健康較差啦，有其他嘅疾病啦，或者係有其他嘅即係佢哋亦都係有呢個醫療係可以俾佢哋去揾噶啦。咁咧就係有啲人咧就會有60%人咧係會自己上網查資料嘅，咁咧就有50%幾咧就會係只係用自己嘅家庭醫生嘅啫，但係佢即係多過一半人啊，就係話我可以同個醫生，我家庭醫生講嘅，因為同佢識佢啊嘛，咁啊同佢講比較好啲。但係叫我去揾心理醫生，唔制，即係變咗係有呢個咁嘅分別咯。我相信好多唐人都亦有呢個咁嘅問題嘅。
So how do you spot an older adult with depression? Well, there are risk factors and then there are symptoms. And I won't spend a whole lot of time going over all the symptoms, but there are some that are more relevant to older adults that I'll highlight here.
咁咧佢就呢張幻燈片咧就係講係呢個風險嘅因素啦，同埋個症狀啦。咁就主要嚟講咧，佢係會將一啲老人家嘅症狀咧係會寫出嚟俾你睇咯。呢啲係即係老人家多啲有嘅症狀。
Okay, so some of the risk factors are our older adults who are socially isolated, who don't have a lot of people around them. They may have a lot of comorbid medical illnesses. They are more at risk if they're recently widowed, again, meaning they're more socially isolated. If they have pain, chronic pain, lots of pain, or if they have some kind of cognitive impairment. These are all risk factors. In terms of symptoms, things that are really salient to the older adult are things like poor or changes in their appetite. Cognitive impairment is both a risk factor and a symptom. Folks who aren't sleeping well, folks who are feeling kind of more tired, or people may complain with more kind of physical symptoms, things like headaches, stomach aches, and pain. And sometimes older adults, they start doing these regressive behaviors. They start acting a little bit more childlike, or they almost give up. You know, maybe that they were good cooks before, but they start cutting back and they're trying to eat more easy foods, you know, so they're not putting in as much effort and they're regressing. And a lot of these symptoms, if you notice, aren't just kind of idiopathic, or not idiopathic, but idiosyncratic for depression. A lot of these symptoms are the same symptoms that we just see in a regular, family medicine practice for older adults. So there's a lot of overlap. So if you think about it, our older adults are really at risk.
So how can you tell whether they have psychiatric problems or not, if they overlap with other geriatric symptoms?
Yeah, that's a great question. And sometimes the older adult may not actually complain of psychiatric symptoms. You actually have to go a little bit deeper. And as Descartes pointed out, having low mood or lack of interest is usually you require one of those two things for depression. But older adults, especially Asian older adults, may not say that they're sad or depressed, but maybe that they're not as interested in things anymore. And maybe they're doing a little bit more giving up. And usually these other symptoms, feeling guilty, hopeless, feeling like they don't want to be here anymore, are a little bit more can indicate depression. And so you have to dig a little bit deeper, especially I think for an Asian older adults who may not be always forthright telling you these symptoms.
So challenging, huh?
It is really challenging. So you really do have to get to know people a little bit and listen very carefully.
Yeah, primary care physicians here.
Yeah, I know they have hard work.
Perfect for them, yeah. So 呢個咧就係鄧醫生就講呢個風險嘅因素同埋呢個佢有咩症狀啦。如果係有呢個老人憂鬱症嘅話，咁咧就風險因素咧就我哋大家都知嘅啦。如果佢成日好有周身病痛，又唔出街， 尤其是嗰啲移民咧，咁嚟到呢度又冇咩家人啊，又冇咩親戚朋友啊咁樣樣，咁咧又開始老咧，就有啲開始有認知障礙啦。咁啊有時懵懵地咁樣嚇，咁啊周身痛啦，年紀又大啦，咁又可能最近又個 partner 又即係過咗身啊咁呢啲咧就係一啲非常高嘅風險因素咧，係會引到呢個引到呢個憂鬱症發生嘅。咁咧有咩症狀咧？咁正話都講過啦，就即係問你啊，到底你係咪咩嘢都唔想做啊，咩都冇興趣啊，出街又冇興趣啊，食嘢又食之無味啊，睇即係呢個認知障礙咧，就亦都係風險，亦都係症狀啦嚇。咁咧就瞓得唔好啊，成日覺得好攰啊，烏眉瞌睡啊咁，同埋覺得咧，唉，冇咩人生樂趣啊，感到自己好有咩嘢都覺得就係自己錯啊，可能我做錯咗呢樣嘢，做錯嗰樣嘢，覺得好絕望咁嘅思想。咁咧就曾經都諗過不如早啲死啦咁咧就呢個身體裏邊咧就好多時又覺得嘢成日頭痛啊，一陣唔係頭痛咧就肚痛啊，一陣間又胃痛啊，總之好多痛啦，係嘛？咁咧就係將呢個精神病咧就變咗做一個痛嘅症狀，咁呢啲係好時常會發生嘅事嘅。咁同時咧有啲人咧就越嚟越好似變咗細路仔咁喎。啲咁多嘢佢又唔中意啊，佢同你大嗌啊，即係好似細路仔發爛渣咁樣樣啦，咁變咗咧呢啲咁嘅症狀咧一堆咧，你如果係家人你見到咧，就可能知道呢個老人家咧已經係開始有憂鬱症咧，就可能要叫佢去睇醫生，睇下精神科醫生，等佢有得到個適當嘅治療咯。但係如果你唔理佢咧，但係其實好多呢啲人咧就老人家咧，就算係有某部分嘅症狀咧，佢都未必一定有精神病嘅，所以係要有個精神科嘅專家去真係去認真同佢調查一下有冇，咁然後再同佢去做呢個治療咯。
So how do I get my older Asian adult to really care about treating depression? Well, sometimes I tell them about all the other things that can happen with untreated depression. That depression is actually a risk factor for cognitive impairment, right? So a lot of my older adults want to protect their intellect, they want to protect their memory as much as they can. Well, depression is a risk factor for Alzheimer's disease, vascular disease, and so we've got to treat it. Oh, that's a great way to optimize people's thinking. Depression is the second leading cause of disability in older adults. So in order to live a good life, we've got to treat depression. You know, it's only secondary to heart disease. So if you think about it, heart disease is such a big problem, but depression is right behind it. And then other things that I have my older adults consider is, you know, depression can also worsen some of their other medical conditions. It can worsen their cardiovascular disease. It can worsen their diabetes. And we think it's because, as Descartes mentioned, there's this common factor of stress that goes on in the body. And that depression is also puts us in a chronic state of stress. And also cardiovascular disease, diabetes, hypertension, all of those things also get worse with stress. And the other big thing to think about with treating depression for older adults is, you know, depression in and of itself increases the mortality rate of older adults. And older adults also are very invested in living longer. And so there's the risk of completed suicide, of course, as Descartes mentioned. But studies have shown that older adults who are depressed are kind of 1.75 times more likely to die compared to their non-depressed counterparts. And then there was another study that also showed that the risk of dying within 15 months of those who are age 55 and older, it was 4 times higher in those with a mood disorder or a depressive disorder compared to those without a depressive disorder.
咁正話董醫生已經講過，係好多人咧就有呢個憂鬱症嘅時候咧，就唔去揾醫生噶嘛，係揾家人啊，或者係隔離鄰舍啊，或者朋友咁樣講噶嘛。咁咧，但係即係當然，董醫生如果知道佢嘅病人係有憂鬱症，可能有憂鬱症嘅時候咧，就當然係鼓勵佢去治療啦。但係啲病人點樣去鼓勵佢哋去治療咧？董醫生咧就話啦，咁佢咧就可能要講出嚟計仔啦，就要話俾呢啲病人聽唔治療嘅利害關係啦。咁有啲咩事咧？佢話嗱， 我哋通常都唔想話做失智㗎，即係你病啊還病，但係個腦好似冇咗咁嘅懵靜靜嘅咁樣就即係個個都唔想嘅。咁佢咧就會提佢哋話嗱，你有呢個阿爾茲海默症嘅病咧，係會增加嘅個風險㗎。你有心臟病啊、血管病咧，亦都會增加風險㗎。殘障咧，亦都會增加㗎。咁同埋你會將其他嘅病咧係會惡化咯。其他你譬如血壓高啊、糖尿病啊、諸如此類嗰啲，咁嗰啲病咧亦都係會惡化嘅。咁你死亡嘅風險咧亦都會增加啦。即係自殺嘅人可能個比率咧係如果係有呢個憂鬱症同冇憂鬱症嘅人咧，冇憂鬱症嘅人咧係會少啲嘅，有憂鬱症嘅人咧係會多成 1.75 倍嘅。咁當然大家都應該明白點解啦，係嘛？咁咧仲有咧，佢話如果係有憂鬱症嘅人咧，如果你唔做治療嘅話咧，通常喺15個月之內咧，你俾一啲冇憂鬱症嘅人咧，個死亡嘅風險係多4倍嘅，因為你會惡化其他嘅慢性病啊嘛，你會惡化其他因為你咩都唔想做，你又唔食 ，OK， 又唔想出街，你又冇去運動，呢樣嘢都係即係好負面嘅，咁所以咪會將個死亡嘅風險係會增加咯。咁所以佢呢個就係董醫生嘅教病人嘅方法啦。
Yeah, so when we think about depression treatment for older adults, we've got a few goals here. I mean, why are we doing this? Well, of course, we want people to feel better so they don't have so many symptoms, but we also want them to have restored function and operate and be the best that they can. We want to prevent sort of downstream complications. So that includes kind of worsening of their medical conditions. We want to prevent disability. And of course, we want to prevent suicide. And also we want to prevent, relapse, recurrence. We want to prevent an episode from happening again. And I think it's also really important to think about our older adults, and especially our Asian older adults who usually have family members who are caring for them, that it's not just the patient who is impacted by all this, it's often the family around them that also takes on a lot of stress, a lot of the caregiver support that they take it on. So treating a patient and treating their depression not only improves their quality of life, but improves the quality of life of the whole family and the caregivers around them.
咁呢啲咧就係如果有憂鬱症嘅病人咧，嗰啲醫生治療要點樣去醫佢哋咧？咁第一就係減低佢哋嗰個症狀啦。如果佢咩都唔食啊，咩都唔想做，咁你梗係想減輕佢嘅症狀啦，係咪？咁第二咧就係將佢冇咗嘅功能咧，希望可以幫佢復原。OK， 咁就第三咧就係譬如佢如果係有一啲殘疾啊或者自殺嘅傾向咧，我哋咧係希望可以預防佢唔好整傷自己或者去自殺嘅。咁第四咧就係防止佢舊病復發，即係希望佢有咗憂鬱症之後，幫佢復原咗之後，希望佢唔會再有憂鬱症啦。咁第五咧就係唔係講病人啦，係講照顧病人嗰啲照顧者啦。咁咧佢嘅家人啊朋友啊照顧呢啲病人咧，我哋都要關懷下佢哋，係睇下有咩嘢可以幫到佢哋，等佢哋冇咁辛苦嘅。咁呢個就係治療嘅目標。
Great. So I wanted to finish out my portion to give some really practical tips of what you can do, whether it be you're a patient, you're a provider, or a family member. What can you do? What advice can you give to some older adults to prevent depression or even start the treatment of it? So these are sort of tips that can be applied to anybody. My first expert tip is to start walking. This is probably my number one recommendation for my older adults, because not only does it get you up and moving, and so that your physical health is a little bit better, we also know that walking in and of itself is very neuroprotective. So it helps lift your mood. It helps keep your cognitive function kind of strong and sharp, because as you're moving, you're using different parts of your brain too. And it gets people out of the house a little bit too. And so people inevitably just start feeling better if they start walking. And so I think you get the biggest bang out of your buck if we get people up and we get people moving.
That is such a great tip. Because there's so many things that one can do, right? But walking is one of the very most important. 咁咧，呢個咧就係董醫生咧就話叫個人起身去行路、行出街，呢個係非常非常之有用嘅，係幫到佢嗰啲血氣運行啦，等個腦諗多啲嘢啦，個身體活動、筋骨活動多啲啦，同埋多一啲荷爾蒙出嚟，係等到個人開心啲啦。咁佢話呢個咧係對呢啲有憂鬱症嘅病人咧一個非常非常之大嘅幫助嚟嘅。咁簡單就係行路啫嘛，就幫佢行路咯。
My number 2 tip for everyone is sleep and work on sleep. Now, sleep is tough for older adults because as you age, natural changes happen. You sleep not as deeply, so you sleep lighter, but there are other things that we can do. We can make sure that we're not using the screens before bed, that we're not doing anything too exciting. We can make sure that during the day we're moving around so we get tired at night, that we're not drinking so much caffeine during the day, because as we get older, caffeine can stay in the body up to 12 hours. And so you can imagine a little bit of caffeine in the morning, like around 2 o'clock, can still keep you up at night. And so sleep is also great. It also helps you think more clearly, helps you feel better in the morning. You're just a little bit less irritable and you just have a better mood. So I think sleep is a tough one, but sleep is also really important to pay attention to.
第二樣嘢重要嘅咧，就係我哋嘅睡眠啦。一啲咁簡單嘅嘢，行路同睡眠同埋食嘢係嘛？咁咧睡眠咧，董醫生話啦，我哋係真係可能要留意下嗰啲咖啡因嘅，因為嗰啲我哋年紀大咗咧，嗰啲咖啡因咧喺個身體裏邊咧，可能係會留耐啲嘅。可能你係即係佢可能喺身體嗰度留12個鐘頭嘅，都有好多喺度嘅，咁就整到我哋夜晚瞓唔到覺咯。所以佢話瞓覺之前咧，就最好前嗰10個鐘頭到嘅唔好飲咖啡啊，唔好飲咁多茶、濃茶啊咁咧就到瞓覺嗰段時間咧就係比較環境安靜啲咯，唔好整到咁多刺激性嘅嘢，唔好睇啲打鬥片啊，整到自己個人好興啊嗰啲咁嘅嘢啦，係嘛？咁所以佢話呢個睡眠咧係非常之重要嘅。
My third tip for everyone and for my older adults is to socialize. And this is so important because as my older, especially my Asian older adults want to stay home, and I think this goes back a little bit with what Descartes was saying, that this got worse in the pandemic, that older adults got so scared of COVID and there were so many restrictions that they just had to stay home. They had to be isolated. And it wasn't good for them. We saw people get more depressed. And it's so important to be around other people, to talk with other people, to be with family, to be doing something at the same time. Again, this is also, we know it's neuroprotective. It not only makes us feel better, but it also protects our memory at the same time.
咁咧就第三咧就係社交活動啦。咁其實呢個新冠疫情嘅期間咧，就我哋係要隔離噶嘛，係嘛？唔好惹到啊嘛。咁所以咧呢個新冠疫情真係好慘嘅，整到嗰度老人家咧就個個喺屋企嗰度。第一就驚咗啲病毒唔敢出街啦，第二驚人打唔敢出街啦。咁所以咧好多原因係等佢哋受驚受怕係唔想出街嘅，咁啊變咗少咗社交活動咯。你唔出街咁要人嚟揾你先得㗎，係咪？咁如果你冇咩朋友冇咩親戚嘅，咁啊變咗即係個社交活動少咗。但係呢個社交活動咧係會影響我哋嘅精神健康嘅，咁係會等到個人即係精神啲啊，個腦嗰度咧係有受到呢啲其他嘅人大家互動嘅刺激啊，咁樣係會幫到我哋冇咁容易呢個憂鬱症咯。
My next tip is accept help. And I feel like this particularly goes out to my Asian older patients because a lot of my older patients, maybe they get sicker, maybe they start to lose some function, but there's still this feeling of, you know what, I don't want somebody in my house. I don't want any help. I can do it myself. I mean, I think about my own mother sometimes. But it's okay. Again, sometimes when they are looking for help, maybe they say like, I only want my daughter. I only want my son to help. And sometimes it becomes so great that it's not just one person that can do it all, right? And so it is really okay to accept help from outside the family, from other people. And you know what? Maybe sometimes when we accept help, we get a little bit better quality of life, and it's a little bit less stressful for everyone. So I think this is a big point, that it's okay. It's okay to have help from other people sometimes. And I hear a lot of times, for example, I would go out and do this, I would go out and do that, but I can't because I don't have transportation. I have no way to get there. Again, it's okay. It's okay to find other ways to get you there. You don't have to do it all yourself.
So actually, self-help for the elderly has a program. They were funded to have a program to have people to assist elderlies to go to different places, like even shopping for groceries or going to see the doctor or just going out for a walk, So look up for the self-help for the elderly's phone number and that have them send somebody out to you.
Yeah, so important.
Yeah. So 呢個咧就係我哋唐人咧好多時咧就唔想麻煩人啊，淨係話我等我仔翻嚟先啦，我等我女翻嚟先啦，你唔好麻煩你啦，唔好意思。唔好意思呢幾個字咧就害死好多人嘅，因為咧我哋唔好意思啊嘛，唔想俾嗰啲陌生人嚟幫我哋啊嘛，唔好意思，我哋唔識你嘅人幫我有乜好意思啊咁。但係實在呢個世界咧係好多陌生人咧係會好即係有伸出同情之手去幫一啲需要佢哋幫助嘅人咯，所以俾啲機會佢哋去幫我哋啦。佢哋又開心，我哋又開心，我哋啲仔女咧亦都係比較冇咁辛苦咯。你樣都等啲仔女翻嚟做，佢哋好辛苦噶嘛。咁所以咧，我哋係應該有一個接受幫助，有一個感恩嘅心態咧。等人去幫下我哋又好啲，人哋又開心啲。
My next tip might be a little controversial, but I think I need to say it, is that sometimes, you know what, medicine is okay. A lot of the other big thing I see with my older adults, besides that they don't want anybody to come into their house to help them, is they don't want to take any medicine either. And if we can do all of these other things and you know what, the mood is better, then I think that's fine. Then you don't have to take medicine. But sometimes we don't want to wait till symptoms to get so bad. And sometimes when they do get really bad or severe, sometimes we do need to turn to medicine, and it is okay. I think a lot of people worry about medicine is going to cause a lot of problems. And you know what? If you have a lot of medicine, sometimes it does, but we just have to be very careful, work with your doctor, talk about with your doctor what you're worried about. What side effects are you trying to avoid? And your doctor can work with them. I have a lot of patients who come to me and they're so nervous. And maybe we start a little bit of medicine and we work our way up, and they come back to me and they say, wow, why did I wait so long? And so the message I want to give is work with your doctor. Medicine, sometimes it's okay. We just need to be careful.
咁咧，呢個鄧醫生咧就話，我哋有時啲藥咧，真係或者可以幫到我哋嘅。我哋當然係唔想食，即係唔需要食嘅就唔食啦。但係有時咧，佢真係幾有用下嘅喎。譬如你發燒，你食啲退燒藥，佢真係會退燒嘅喎，係咪啊？咁所以咧，啲藥咧有時係有幫助嘅。所以我哋唔好對所有嘅藥都拒抗。咁譬如就係而家呢個咁嘅憂鬱症咧，有憂鬱症咧係有藥可以幫到我哋，等個人冇咁憂鬱嘅。咁咧，如果係有少少藥可以幫到我哋開心啲嘅。咁我哋可以試下睇下有冇用啊嘛，如果有用嘅咪食咯，係咪？咁當然好多老人家咧都食好多種藥嘅，可能1、2、3、4、5、6、7、8、9種10種藥嘅。咁你如果係擔心嘅咧，你咪可以去問下你嘅醫生，問下啲藥劑師話，喂，我食咁多藥，有冇邊樣嘢係交叉㗎？有冇邊樣嘢係即係重複㗎？同我睇一睇啦。咁你可以問嘅，但係咧就即係個心咧就唔好話咁拒抗，因為唐人咧好多人咧，你叫佢去執劑藥嚟食就得，食嗰啲中藥啊。但係你叫佢食粒西藥咧，有時好難嘅，因為佢覺得嗰啲西藥太過強、太過勁啊，唔啱佢啊。OK， 所以有時可能要改變呢個態度，試一試，真係唔得，咁你咪唔好用咯。
And my final tip, and maybe it's the most important one after walking, is fight the stigma, because it's been really taboo in our culture to be talking about depression, to say that you have depression, to even conceptualize depression. I know, in Vietnamese culture, I mean, sometimes we don't even have the language to talk about depression. And so I think it's really important to talk about it, to say, hey, it is okay to talk about it, but to also treat it. So I think in order to address depression, it just has to be out there. And I think the more we can talk about it and share with our family, our friends, because as I said in the beginning, they may not come to me as the doctor, as a psychiatrist. They may come to you. And so the more you know about it, the more you can talk about it, the more we can fight the stigma, the more we can care for our older adults.
咁呢個我哋係會有時覺得好羞恥咯。如果話俾人聽話自己我有憂鬱症啊咁，即係唔想講啊。呢啲係好似家醜不出外傳咁啊，唔想話俾人聽。咁但係如果你譬如你自己係家人嘅，咁你同嗰啲長者講多啲有啲關於憂鬱症嘅問題啊，或者好多人都有啊，或者啲咩症狀啊，我都覺得你有講啊乜乜乜啊咁樣，你即係帶佢出嚟講，等佢覺得係可以講嘅，係呢件事可以攞出嚟傾偈嘅，等佢覺得唔好咁羞恥，唔係一個會傳染病人嘅傳染俾其他人嘅症狀嚟嘅咁所以咧就希望大家可以將件事攤開嚟，大家坦白啲，大家做個對話咯。
So just to end and summarize, to remind us that depression in older adults can present with a lot more physical symptoms, and they may not tell you that they're feeling bad or depressed. So we have to be on the lookout. The whole reason why we're trying to treat depression is to improve the quality of life for the patient and all the people around them. And then to really address depression, we've got to do a lot of different things, not just one thing. And it's not just medicine. As you notice, 5 out of 6 of those tips had nothing to do with medicine. So it takes all of us. It takes a lot of work.
咁呢個做個總結咧，就係話好多時憂鬱症嘅症狀咧，唔係話即係有咩心理嘅症狀俾你睇到，而係個身體嗰度咧係有其他嘅症狀會出現嘅，即係覺得好攰啊，或者係瞓唔到啊嗰啲咁嘅症狀啦嚇。咁咧就如果係治療憂鬱症咧，主要嚟講咧就係提高嗰個長者嘅生活質素，同埋希望可以預防到其他嘅慢性嘅病咧係唔會有呢個併發症咯。咁咧就我哋亦都睇到啦，我哋唔中意食藥係咪？咁但係咧，你見到治療憂鬱症裏邊咧有佢正話講咗6樣嘢，其中5樣都唔係藥嚟噶嘛，最拉尾嗰樣先至係藥嚟噶嘛。如果我做呢5樣都唔得啦，咁我就試下用藥，即係呢個係最後嘅方法嚟嘅。所以唔好怕去見醫生去做呢個憂鬱症嘅治療，因為係有不同嘅方法可以幫到大家嘅。Dr. Hwa Soo Hoang is going to talk with us about another spectrum of our lifespan, which is the youth and the teenagers and the young adults. And so Dr. Hoang is the associate clinical professor in the UCSF Department of Psychiatry and Behavioral Science. And so we welcome Dr. Hoang. 呢個洪醫生咧就係韓國人啦，咁佢咧就係我哋呢個加州大學舊金山分校精神病學同埋行為科學系嘅副主任嚟嘅。咁佢咧就會同我哋講呢個移民家庭同埋青少年之間嘅抑鬱同埋焦慮症。
So we're going to talk about what are the warning signs of depression and excessive anxiety in youth, not just regular anxiety, but something that could be bad. We're going to learn how to address that. Spot those.
咁呢個洪醫生咧就話佢咧就會用盡量簡單嘅方法嚟到演繹佢呢段嘅資料，而且佢呢段嘅資料咧有一大部分咧已經係俾李醫生同埋董醫生係講咗噶啦，咁佢咧就會專注講佢應該講嘅嘢啦。咁咧就係第一點咧，佢咧就話會同講青少年嘅抑鬱同埋過度焦慮有咩警告嘅徵兆。
And we're going to talk about why it is important to know how to spot them as parents or uncles or aunts.
咁同埋點樣可以早發現佢嚇？
Or grandparents, and what to do if you suspect a youth is suffering from depression or anxiety.
同埋你如果覺得有個細路或者係少年咧，佢係患有憂鬱症，咁你應該點做咧？咁
And what happens in psychiatric treatment if you actually decide to go for it?
咁到底如果真係要去呢個治療嘅時候，到底會有咩事發生咧？有冇問題㗎？咁佢就會將呢啲嘢簡單介紹俾大家聽。
So Dr. Li talked about this a lot, but there's been a long history of open and not so open forms of prejudice that we Asians had to face in the United States.
係，我哋華裔都係，即係亞裔都係受到好多歧視㗎啦，同埋好多偏見嘅。
Within the last few years, there's, we all know this growing political tension between US and China that is overtly being talked about. COVID-19 has uncovered a lot of dormant bad feelings towards Asian, and it really just sort of brought it out into the open. And we've seen many episodes of openly violent acts towards Asians, which is just pretty much just flat frightening and scary for people.
咁過去呢2-3年咧，咁我哋即係呢啲嘢之前都講過㗎啦，但係點解佢又再講咧？就係因為係咁個個人都覺得係咁重要咯，即係影響得我哋咁多咯，就係中美之間嘅關係啦，新冠疫苗肺炎對我哋嘅問題啦，同埋好多即係對亞裔嘅暴力咧，即係影響我哋每日嘅生活，所以個個醫生都講嘅。
So what's unique about youths from immigrant families, like myself or other other folks here, I think many of us are from immigrant families. So the thing about youths is that they have daily interactions with peers and teachers in school. So they're constantly exposed to incoming prejudices and other behaviors that can be targeted towards Asians.
咁因為好多青少年咧都係來自移民嘅家庭，而佢哋咧又要返學，咁喺學校嗰度有老師，有其他嘅同學，有其他嘅朋友咁，所以咧佢哋係有好多互動嘅時間，咁咧就會可能有啲即係而且仲有社交嗰個網上成日上網啦，咁佢哋係會有受到好多嘅衝擊嘅生命嗰度。
I'm pointing this out to say that we as parents may not have daily interactions sort of immersed in what would be like American society. If we work at a shop, we have limited interactions with folks. If we have daily routines that may not necessarily involve interacting with other folks and folks from other backgrounds, our kids are constantly exposed to, America, basically.
我哋大人咧，可能係冇時間同嗰啲細路仔互動，或者係因為我哋要做某一啲嘢，咁係比較專注啲嘅，係冇啲細路仔咁樣周圍咁樣又玩啦，又上堂啦，又周圍去啦，咁又周圍上網睇嘢啦，咁佢哋咧就真係喺呢個美國嗰度親身咁樣體驗到美國長大嘅過程嚟嘅。
And young folks, just by the virtue of where they are in life, they spend a lot more time on social media and internet where they can be exposed to these sorts of hate and other bad sentiments from society at large.
咁因為佢哋周圍去同其他嘅人接觸咧，周圍上網咁樣去睇嘢咧，咁佢哋係會有好多機會咧係感覺到呢個俾人仇視啊，俾人歧視啊咁嘅情況嘅。
And these young folks are already juggling several identities while they're trying to figure out who they are in their teenage.
咁呢啲青少年其實好慘啊！佢哋其實都即係佢，譬如佢係移民，佢好似李醫生咁，洪醫生咁樣係韓國人。咁佢到底佢而家係韓國人咧，因為美國人咧，因為乜嘢人咧？人哋又你自己覺得你自己係咩人，咁人哋又睇你又覺得你係咩人咧，所以個身份嘅認證嗰度咧係好模糊，係非常之混亂嘅。第一個青少年細路仔嘅心態嗰度。
So a direct attack on their identity as Asians can have more of an impact, arguably more of an impact on young folks.
咁所以當佢哋自己都唔知道自己係邊個嘅時候咧，佢哋細路仔嘅時候受到呢啲咁嘅困擾咧，係對佢哋嘅影響會比較大啲。
And I'm sure as parents, we try very hard, and I have not yet come across a single parent of immigrant families who did not deeply care for the well-being and success of their children.
咁所有移民嘅父母好多時嚟美國移民都係為咗啲仔女啦，咁個個其實都好錫啲仔女嘅，但係錫之餘，但係到底佢哋睇唔睇到個問題所在咧？係咪？
But despite how much we care, we can still have blind spots, and we will have blind spots, and that's just how parenting works.
咁雖然佢哋係好錫啲仔女，但係佢哋好多時即係有啲嘢佢睇唔到噶啦，即係個盲點，即係話睇唔到嘅地方。
So signs of depression and excessive anxiety in young folks. So if they're suddenly crabby, right? They're teenagers, they're going to be crabby, but they're much more crabbier than usual, or they seem to be sulking more than they usually do. So what we're looking for is deviation from how they usually are.
咁有咩症狀係等我哋知道啲細路仔可能係有憂鬱症或者係有過度焦慮嘅跡象咧？就係譬如就係主要嚟講咧，就係佢而家嘅行為啊，係同以前係有一個唔同嘅地方嘅。即係佢而家咧變得個人咧，有時會話，佢而家都唔知做咩嘢嘅，個人都變到懵晒嘅，啲咁多嘢佢係發脾氣嘅，又有時咧就叫都唔睬嘅，情緒好低落。即係你見到係有一個改變。
It's easy to say, oh, he's not depressed. He's just angry and irritable. So that can't be depression. That is incorrect. A lot of young folks get depressed, and then the depression will manifest as irritability, crabbiness. So it's important to spot those.
咁有啲父母咧就可能唔知道呢個係憂鬱症嘅，因為憂鬱點會成日去鬧人㗎？點解佢成日發脾氣，成日咁猛㗎？你憂鬱應該係唔出聲匿埋喺角落頭嗰種噶嘛，係咪咁？咁但係咧，其實青少年嘅憂鬱症咧，好多時咧就會表現出嚟嘅表現咧就係好猛啊，啲咁多嘢發脾氣啊，同埋個情緒嘅波動好大。咁呢啲係佢哋嘅憂鬱症嘅表達嘅方法嚟嘅。
And if you see sudden changes in how they interact with their friends or how they interact with you, they're spending more time on social media, they're spending less time on social media. Again, if you notice these sort of deviation from norm in terms of change in social interaction with friends, it's a cause for concern.
咁你要幾時先至覺得係有問題啦？就係你知道佢係有一個轉變。佢或者係上網嘅時間成日都上網，以前都唔係咁嘅，而家越嚟越耐，越嚟越成日都係上網，或者係同朋友嘅喺個電話嗰度聽到佢同朋友嗌交，以前都冇咁嘅，而家係咁，即係你覺得佢嘅行為有改變嘅時候咧，你就應該留意下，佢可能需要幫助。
An example would be, your kid is now spending less time on social media. He's like locked in his room. He's not making a lot of noise. You're thinking, oh, maybe he's reading his room finally and not we're not using social media, but that can actually be a sign of depression.
咁可能咧，佢又唔係上網咩嘢，但係佢咧就將自己搵一間房度，可能睇電視諸如此類啦。咁但係你見到佢咁自己瞓住間房，連門都鎖埋嘅，唔直情俾你入嘅。咁所以咧，你即係有啲咁嘅突然間好出奇嘅行動咧，你就可能要留意一下，喺呢個係咪憂鬱症啦。
And you'll see change in eating habits a lot. They used to be a big eater. Now they're really not eating that much, or they're eating a lot more than they typically do. And you're wondering what's going on.
咁咧可能咧食嘢嘅習慣又改變啦，可能突然間食好多喎，食極都唔飽咁，成日都食嘅。咁有啲另外一方面咧係可能突然間唔食嘢喎，成日都唔食嘢嘅，好似做神仙咁嘅。咁所以咧佢嘅飲食嘅習慣一有咁大嘅改變嘅時候咧，而你都留意到嘅咧，咁呢個可能係同個憂鬱症有關係啦。
And you'll see changes in sleep. They sleep a lot more. They're sleeping a lot less.
咁有好多人咧就瞓覺啦，瞓好多覺啦，有啲人就成日瞓啦或者係個習慣改變啦。而家咧就夜晚做夜遊神，日頭瞓覺啦，或者咧就唔瞓日日都唔瞓，瞓好少嘅。咁你見到呢啲好大嘅瞓覺嘅轉變嘅時候咧，你亦都要留意下啦。
And they suddenly stop doing much poorer in school, even though they did well before. That could be an important sign.
咁可能個細路仔咧突然間嗰啲成績咧大跌喎， 以前都幾好嘅，攞 A、B 嘅，而家攞 C、D、E、F 啦喎。咁你即係知道佢係個成績大跌嘅時候咧，你又應該留意下啦。
And suddenly not wanting to go to school, that can be an issue.
咁連學都唔想返嘅，好大劑啊！
And then sort of vague physical complaints that do not seem to respond to the usual treatment, meaning, they're talking about having belly aches and, you give them the usual whatever, it doesn't work. They're saying they have headache, you give them the usual Tylenol or what have you, and nothing really seems to touch them, and they say the same thing.
咁你可能咧，佢可能咧就有啲身體嘅症狀啊，呢度又唔妥，即係嗰度又唔舒服，嗰度又唔舒服咁。咁譬如話肚痛咁或者頭痛咁，你俾啲藥佢食，咁啊通常咧食嗰啲藥咧就個頭痛咧就冇咗噶啦。但係而家咧冇用喎，食藥都冇用喎，咁即係變咗咧係有啲問題啦。
So the point that I was trying to make with the previous slide is that any one of those symptoms may not be that alarming, but when you start noticing 2, 3, 4 of those, alarm bells should start going off.
So let me go back to that slide.
Sure, yeah.
So 你洪醫生就講咧就話，你可能咧會睇到呢度呢個表裏邊嘅其中一樣嘢啊、兩樣嘢咁樣，你又開始留意，就可能係未咁大件事嘅。但係當你發覺有3、4、5、6、7樣樣都有嘅，有咁多問題嘅，咁你咧就知道呢個人咧就真係可能有個憂鬱症啦。咁所以就要
So why is it important to know the signs? And Dr. Duong touched upon this, Dr. Li touched upon this. 10 to 15% of young people are clinically depressed, meaning they are depressed enough to meet diagnostic criteria for a mental illness and require treatment. That's 1 out of 10 or 1 out of 8 young people.
點解要係咁重要留意呢啲人咧？因為我哋正話都睇到啦，嗰啲圖片啊，係原來有憂鬱症有精神病嘅人咧，最大部分嘅人咧係呢啲青少年同埋呢啲後生仔啊 ，OK， 所以當佢係9歲、27歲嘅時候咧，佢係好有成10至15% 嘅青少年咧係有呢個臨床嘅抑鬱症同埋焦慮症嘅。
And there are many more who are undiagnosed and therefore untreated, and these numbers presumably only went up in the recent past, especially pertaining to Asian American young folks.
咁你呢個係我哋知道嘅啫喎，呢10至15%，但係有好多種連又唔知道又冇揾人治療嘅喎，咁嗰個有幾多咧？就真係不得其知啦。咁咧，但係我哋知道呢啲當你有呢啲咁嘅病嘅時候咧，係會影響成個人甚至一生噶咯。
And I mean, as Asian parents, I think this is important. It's important for any parents, but it'll affect the child, the young person's academic achievement.
咁亦都當然影響佢嘅學業啦，係咪？咁啊，父母好緊張學業噶嘛。
Their social functioning as well, and it'll increase their risk of, attempting and or completing suicide.
咁咧，亦都會係影響佢哋喺個社會裏邊立足啦，同埋咧係會增加佢哋嘅自殺風險嘅。
And I don't think I would be exaggerating if I were to say that might be one of the worst fears for any parents.
咁洪醫生咧就話，呢個咧就係父母最擔心嘅事咧，就係驚住嗰啲仔女係因為有憂鬱症而去自殺。
Most important thing is do not suffer alone. Asian immigrants, just like Dr. Li and Dr. Duong pointed out, we tend to sort of internalize things, not reach for help, and we try to tough it out. We try to just sort of do it on our own. And it's not really going to work in these cases.
咁而家咧就係咁嘅問題咧，同老人嗰度一樣嘅，就係唔想人幫助，驚住俾人即係笑。咁所以咧，呢個咧又係洪醫生咧又提我哋啦，就算係青少年都好啦，真係我哋可能要幫助嘅時候，就要去揾人幫助咯，唔好話自己去硬咁撐咯。
So what's available? The first thing you can do is you can consult your child's pediatrician or your primary care doctor. And I understand that those folks also have limited training and or understanding of these things. But it's important to connect to your pediatrician because, first of all, you already have an ongoing relationship and trust that you can build on. And who else could you really, reach out to, at the outset? So do reach out to your primary care doctor and your pediatrician.
咁洪醫生咧就話你首先要去揾邊個幫你咧，要揾人幫助，right？咁佢話最好咧，第一個咧就係揾你嘅兒科醫生，因為你已經熟咗佢啦嘛，佢又識你個細路啦嘛，咁所以就揾佢哋先。
And I hope that doesn't put too much of a burden on, pediatricians or primary care doctors present in the audience. Also, San Francisco Department of Public Health, they do have a toll-free number with interpreter support for Cantonese, Mandarin, other dialects, and other languages. So we really should make a use of that.
咁或者去打呢個公共衛生局啦，嗰度亦都有翻譯嘅人員嘅。
Something that we tend to forget is the more we call these services and more we demand that we be provided these services, the more the powers that be will react and address these issues.
咁有一樣嘢咧，我哋可能冇留意嘅咧，就係當我哋嘅需求係多嘅時候咧，咁咧就可能受到社會多啲關注嘅，多啲資源嘅。
And there's also UCSF's own Child and Adolescent Psychiatry portal. There's a web address and there's a toll-free number. You can talk to those guys too.
咁咧就喺呢度呢個加州大學咧，亦都有一個電話係可以打嘅。Is this a free call?
Yeah, these are all toll-free numbers, and there's no fee for consultation. You can just straight up call these numbers. I mean, and the more you call them, the more staff they're going to have. We have to create demand in order to get response. So it's important that we all call these numbers when the need arises.
咁就係所以我哋唔好有樣嘢收埋自己屋企嗰度，自己去搞，自己去應付。因為你唔話俾人聽你有呢個需要嘅時候咧，咁個社會都唔知道我哋有個社區有呢個社群有呢個咁嘅需要，咁個社會咪唔會俾資源我哋咯。咁我哋係要打，係要話俾人聽，我哋有呢個咁嘅問題，要求助啦。咁佢哋知道咁多人求助啦，咁我哋咪會多啲資源咯。
We really don't do this enough as Americans. I mean, as Asian Americans. So,
咁我哋喺即係美國嘅亞裔咧，即係通常嚟講咧，就係做得太少啊！我哋係應該做多啲去攞多啲資源嘅。
So what if my kid actually needs psychiatric care? What does it entail? So I'll try to be brief with this. So here's the thing. It doesn't always involve medicines. There are lots of interventions that can be done at school level. When you access child and adolescent psychiatric help, a given is that school will be in the loop, parents will be in the loop, and we will create a coalition of folks who's going to address the young person's issue.
咁咧就大家咧就唔需要咁驚話，我唔想佢食藥喎，所以唔好去睇醫生啦。咁其實唔係嘅，如果你去睇醫生，如果係求助嘅話啦，咁嗰啲醫生咧就會整一個幫助呢個細路仔嘅設計嘅計劃，就會學校又會幫啦，你自己父母又會幫啦，佢嘅朋友，即係總之係會一堆人咁樣去周圍咁樣去支持佢嚟到幫佢咯，就未必一定食藥嘅。
For example, let's say, you're addressing the school, hey, something is going on. Can you see how my son is doing? And the school's kind of, digging dragging their heels. If you bring in a psychiatrist or a mental health professional, it forces the school to act.
咁有時咧，你同個學校講咧，個學校可能即係多嘢做咧，就當你唱歌咁啊，即係冇同你做嘢噶嘛。但係當你如果係將一個介紹一個心理醫生 嚟到同學校嗰度講話，呢個細路仔有問題，要學校都要幫手嘅，要做啲咩嘢。咁個學校咧就相反嚟講咧，就唔會話唔聽啦，就會好合作啦。
And there are quite a few of Asian parents or other parents that I've met over the years, who worry that their child might start getting care without your input. It's probably not going to happen. So that's not something you would really have to worry about.
咁有啲父母咧驚住，叫佢去睇醫生，叫佢去入咗醫療系統，佢都唔知會同佢做咩嘢嘅，可能會對佢有害嘅咁。咁洪醫生咧就話你唔使驚嘅，我哋係唔會做一啲嘢係未得你同意而同嗰個細路仔做嘅。
I believe this is my last slide. I just reiterated the phone numbers again. Here's the thing. Call these numbers to use the help, but also call these numbers in order to demonstrate the demand and the need is there. That's very important in advocacy.
咁咧，洪醫生咧就係話，你如果有事嘅咧，請你真係要打呢個電話。打呢啲電話咧，唔止係可以幫到個細路仔，亦都可以等個社會啊，整體嚟講係攞多啲資源，係關於呢個精神科嘅。
So closing words, don't suffer alone, use the support, use the help. That's my core message.
咁總結嚟講咧，就係你千祈唔好去自己去撐，有問題嘅時候要揾人幫手。你揾人幫手咧，咁咧就會多啲資源去可以俾你利用去幫到你嘅情況嘅。咁咧，如果係大家係有個手提電話咧，可以影咗呢張相嘅，咁你嗰啲電話嘅 number 咧就喺你個手機嗰度，就隨時可以攞出嚟用啦。咁呢啲就係參考資料咧，呢啲參考資料我亦都係會遲啲會寄俾你嘅。呢個講座完咗之後 ，So we have all the faculties back now, and so can we all take a look at the Q&A and see if there's anything that we need to address instead of categorizing emotional reactions as mental illness? Why not use crisis intervention practicum? So is this more acceptable? What do you think?
Well, in the interest of time, I'll make it short. But thanks for highlighting that because, we really tried to make it so that we're not categorizing them by DSM-5 disorders, but trying to really highlight what patients will report. I'm not familiar with the crisis intervention practicum.
咁呢個只係一個朋友問點解唔叫佢做一樣嘢，叫做第二樣嘢咁嘅意思啫。Another child-side DPH resource, the Chinatown Child Development Center. Oh, okay.
Yeah, that sounds great. Yeah.
Do you ever send patients over there?
Do I send patients over there?
Yeah.
I have not personally, but it sounds to me like it would be a good resource. So that's what I could say about that. I'm fairly new to the area, so I should clarify that as well.
Okay. 咁呢個咧就係有一個朋友咧，阿 Ray 咧，佢曾經都係喺心理學嗰度有鑽研嘅。咁佢咧就話喺 Chinatown Child Development Center 喺三藩市嘅 Chinatown 就都有呢啲心理病嘅資源嘅，俾我哋啲朋友嘅。Can you talk more about mindfulness to decrease stress and depression? I think Dr. Li kind of mentioned it.
Yeah, well, mindfulness has been shown to decrease stress. Whether it actually helps with depression that's why it's helpful to have a DSM definition of depression. That hasn't been shown, but it's definitely a good thing to help with stress.
What exactly is mindfulness?
Mindfulness is a meditative technique about which spans a lot of different kind of techniques, but it's really about targeting your thought processes and trying to be slowing down and just paying attention to actually what it is you're thinking about or doing.
OK， 咁咧就呢個問題咧就係問正念啊，係咪可以幫到減壓同埋減低壓力同埋減低抑鬱症狀？咁咧就李醫生咧就話抑鬱症就睇下你點樣去定義啦。咁但係佢話減低壓力咧，呢個係可以嘅，因為呢個正念咧就係其實咧就係好似啲冥想咁，但係你將個注意力咧擺喺你嘅周圍，擺喺你嘅身體。你即係每樣嘢咧都好留意，聽到啲咩聲啊，睇到啲咩嘢啊，個身體裏邊感覺點啊，咁即係呢個叫做正念嚇。咁咧係對我哋有幫助嘅。 is it true that many new immigrants who are not attuned to the American culture are not aware of the microaggression and do not know what it is? And if they don't know what it is, then they don't feel the pressure, they don't feel the stigma to it, and so then maybe it's good, or is it bad? You don't know what you don't know.
I think it's good, probably, if you're not aware of it. I don't know.
I mean, if I may, it could cut both ways, because even if you don't understand the content or the exact sort of angle of the microaggression, you're going to feel some sort of okay, what just happened? Was there something weird? Was there not? And that could actually leave you even more confused. So I think it could really cut both ways. And I'm speaking from personal experience as well.
咁呢個係呢個就係即係唔係撞正出嚟話歧視你嘅，佢呢啲咧係好隱好微，即係好細小嘅，用一啲其他嘅方法去好隱蔽咁樣去歧視你。咁呢啲到底係你唔知啦，你既然唔知，咁你真係唔覺得人歧視你咧，咁係咪好咧？咁洪醫生咧就話你就算係唔知咧，你都可能會覺得有少少奇怪，點解佢講呢啲咁嘅嘢嘅？點解佢做呢啲咁嘅嘢嘅？或者佢點解咁睇我嘅？咁即係你係會感覺到有一啲問題嘅，即係我哋唔係傻噶嘛，係嘛？咁所以咧，佢話好多時，如果你感覺到咧，都係攞出嚟講比較好啲嘅。呢個就係呢個即係都係美國人嘅姿態啦，係嘛？會唔會係 So the third question, will fear about personal safety lead to depression? The fear of personal safety, would that lead to depression?
I think you can wrap in fear with anxiety, right? And if you're in this kind of heightened state of anxiety, I mean, I think that's another mental health condition that we need to address. And then we hear a lot of people saying, anxiety and depression are often linked, or often that they go together. I've heard them be referred to as sisters. Sometimes you have one, you have the other. So I think it's all related, and whether it be directly or indirectly, I think it's related.
咁董醫生咧就話佢覺得係兩樣嘢有關係嘅，即係呢個憂鬱症同埋呢個極度嘅擔心即係你擔心你驚出去啊嘛，呢個咁嘅驚怕咧係兩樣嘢係有牽連。When people are depressed or anxious, does the immune system work against targets like viruses and bacteria? Like it's less as effective for the immune system when you're depressed or anxious?
There's a whole kind of developing field about immunopsychiatry that's going on right now, and it's getting really interesting. I guess the one thing I'll say, and I'll bring it back to what I mentioned, is that, if we're depressed or anxious, we're in this heightened state of chronic stress, and it kind of activates the part of our brains that kind of activates hormones. And so maybe there may be times that it can worsen kind of chronic illnesses that are also related to stress. And at the same time, when we're really stressed or if we're not feeling well, patients are more susceptible to feeling depressed too. And I've had plenty of patients say, I was feeling really bad the other week. And then, but I was also had COVID during that time, and I got better, and now my mood is better too. So I think it goes both ways. Like it's a double-edged sword this way.
咁鄧醫生咧就係話而家有一個新嘅科目科學嘅項目發展咧，就係將呢個免疫系統同埋呢個憂鬱症咧係帶埋一齊嘅做研究嘅。咁就將來睇下會有啲咩發展啦。咁咧就當然啦，我哋都知道好多人咧當佢唔開心咩嘅時候咧，佢係容易病啲嘅，真係覺得係嗰個免疫系統咧係個能力係低咗啲嘅咯。I think this one is for Dr. Hoang. So in taking care of young kids, parents do multiple things, right? And so would activities that give a certain rhythm, regularity, or kind of slowness, like swing the baby, or petting them regularly, gently, kind of get them to take their attention off whatever that they were upset about and help to calm them down. And that in essence would help them not to get so agitated and anxious, calm down the anxiety.
No, this is a pretty well-known technique, not just in psychiatry, but really pretty much in just child rearing in general. This works really well for, kids below the age of toddlerhood. I don't know if there's any really data for kids who are not autistic. Whether they respond to these sort of repetitive, rhythmic sort of soothing technique. But intuition says that it would work. But if we're talking about, so you mentioned babies and young children. So I would say yes. I can't say no. Yeah.
Is there an example of microaggression that we can briefly explain?
I'll just try to be really quick about it. Is when people say or assume things about like, oh, you speak English really well, or I assume that you work at the laundromat when you're just a customer. Those might be microaggressions, or these are things that are kind of under the radar. It's not overt, but it does wear on people, I think. So I think that's a concern. Tammy, did you want to say something?
Sure. I was going to say, and the term micro means that it's directed towards a single person, and that's where the term microaggression. It doesn't mean that it's small. It just means it's towards like a person, versus macroaggression, where the insult is directed towards a whole group of people. So I know the terms can be a little bit confusing.
Thank you for clarifying that. I didn't know that either.
One last thing I'll say about microaggression is if it leaves you wondering why did this person say this, there's a good chance that they may have been microaggression if it leaves you guessing. That's how I might define it.
That's great. Thank you. I just want to thank all of you, and especially the speakers and the team that works in the background, Sandy and Raymond. If you haven't given me your email yet, please write here. And then this is our website for more information on different topics. We are on Facebook, and you can follow us. And we do have a YouTube channel for the Asian Health Institute, and for which we upload all our past town halls. The new vaccine has come out. So if it's time for you to get the new vaccine that targets the BA4 and BA5, the two variants that are infecting America now, please go and go for it. The mask is your constant partner now. That keep it with you when you go anywhere, and whip it out and use it when you feel it's necessary. Keeping distance, ventilation, and frequent testing, all those things are also very important. Why do we say this? Because really the pandemic is not over. As a matter of fact, the flu season is coming on top of a new variant coming out of the horizon now. So we have a lot of things to watch out for. So it is getting better for right now. But the winter's coming, so things can get worse before it's over. Hopefully it'll get over soon. Okay, but it's not over yet at this time. So 大家請保重。個疫情仲未過去嘅，而家有個新波嘅疫情仲係嚟緊嘅。咁咧而家又加埋呢個感冒啊咁樣咧，就所以大家都如果係未打疫苗嘅，就快啲去打啦。如果打咗疫苗都好，而家新嘅疫苗都嚟咗啦，就亦都可以去打嘅。So thank you so very much, our faculty from the Psychiatric Department. We really appreciate this, and the community also appreciate it. But one thing I want to point out as a very last remark is that we didn't have a lot of participants today, and that concerns me. It concerns me as a bottom line type of thing, which is that we are so focused as Asians, so focused on physical health. There's a major neglect on mental health. So even though not as many people come, it was actually expected from my standpoint, but the results are showing me that really we still have that as a big problem. So we have to do a lot more work to do outreach and let people know that mental health is really part of the health. Physical health, mental health, they're equally important, as one affected at the other, both ways. So thank you so very much. And thank you for all those who stay with us till the end. We really appreciate you joining us. And until next time, we'll see you again. Good night. 多謝各位嚇。